Welcome to CVS Health Live, CVS's ongoing series, getting perspective and insights on the leading health issues that are happening now. It's been a year since we have been living with the COVID pandemic. We've lost 500,000 souls here in the United States, more than 30 million people infected, but we've also seen some incredible victories in the war against COVID. We've seen a vaccine developed, 3 of them, in record time, already being deployed. And as of last month, we have now seen more people vaccinated than are infected here in the U.S. We're going to talk about the next steps in this incredible battle and what could be the heaviest lift, the race to get the entire country vaccinated. Joining me are Karen Lynch. She is the president and CEO of CVS Health, and also Albert Bourla, the chairman and CEO of Pfizer. Thank you both for taking the time to talk about this very important topic. And I wanted to start on where we've come from. It's been a year where we've seen probably the most consequential public-private partnership since World War II. And it has led to just this amazing moment where we have these vaccines. Albert, I want to talk to you about it. What has this process shown you in terms of how quickly we've gotten here and what it means for the next step ahead?
Thank you, Bertha. First of all, thank you for having me here, and thank you, Karen, for inviting me in the show. There are so many lessons learned from COVID-19 in so many dimensions that cover many aspects of the social or political or economic life. But for me, the ones that they really stands out, it is, first of all, the power of science. Science is what has changed humanity over the centuries and advanced them always ahead. And science was the one that delivered the solutions once more. The second is what you just said, the power of a healthy, no baggage carrying collaboration between private and public sector. It wasn't going to be possible without those two working in such a great way and with the very clear roles between the two of them. And I would say the third and equally important, it is the power of human ingenuity. The human ingenuity, particularly in cases and times of crisis, where the call of duty is pushing people to not only to go the extra mile, but to be extremely creative and innovative.
You know, Karen, it's a lot like building a really sophisticated plane while you're trying to fly it. You know, I think about first trying to get the system for testing up. Certainly we had a lot of missteps there. It took a while for it to get going. And, you know, we are now trying to move into mass vaccination. What has the last year taught you and the experience of that as we move to a really critical phase to try to do this on a large scale nationally?
Well, first of all, good morning, Bertha. Thank you for joining us. And good morning, Albert. Thank you for joining us. We really appreciate your time. Bertha, you are so right. We have learned a tremendous amount, starting with testing over a year ago. And the first day we did testing, we were doing mass testing sites. And our first experience was putting up a testing site in Shrewsbury, Massachusetts. Just imagine the day. It was windy, it was raining, the tents were flying all over the place. And we were, we learned a lot just from that experience. But what we learned the most was that we quickly needed to shift into our pharmacy stores, where people were in the communities and where people would come to the stores instead of those, huge sites. And we were much more convenient. And since then, we have done over 15 million tests. We have 4,800 sites that are doing tests, and we're doing both point of care tests and our send and swab tests. All of that taught us and got us ready for the vaccination process. And the way I think about this, it's like we're in a relay. Albert and his team did a phenomenal job at creating the vaccine, and they are now handing the baton off to us. And we're taking those vaccines and doing shot by shot, arm by arm, person by person. And we've learned a lot even through our long-term care facility, where 40,000 facilities selected us to be their company that did vaccinations. We learned a lot from that. We didn't realize that we would have to go, sometimes by room. And now we have 2,100 retail locations that are doing this. And we just passed 10 million vaccination shots in arms through our retail pharmacies. And I couldn't be more proud of our team and our colleagues and what they've been able to accomplish. They are clearly the heroes on the front lines, and I'm really thrilled with them.
It's something that we are also very proud that we hand the baton to CVS and companies like CVS, because this has made a tremendous difference in being able to address the challenge of vaccinating. The efficiency, the creativity, and the effectiveness with which they were able to rise to the task is making a huge difference right now, because it's not vaccines that make difference. Vaccinations make the difference.
We started off with the nursing homes, then went to the older population, but we're now at a stage where it's going to roll out to pretty much everywhere. At this stage here in mid-April, we've got, almost 24 states that have opened it up. When that opens up, that demand surges, and oftentimes there's frustration trying to get in. From what we saw earlier in the pandemic, what are some of the things you have changed? I mean, Albert, are there things that you're thinking about changing in terms of getting the distribution to work more smoothly? Initially, the concern was always that we never had enough supply to meet demand. Do you feel like you can meet this moment?
Yeah, there are a few things that we can do because it's under our control, and there are a few things that others needs to do, like Karen and CVS, to address this challenge. I think what falls under our responsibility and control, the most important is to increase our manufacturing capacity. This is the most important. This is not only about the US, this is about the world, this is about Africa, this is about Latin America, this is about Europe, this is about Asia. So there are billions of people that are waiting the vaccine. And to that front, I think we are doing very, very well. I'm never satisfied. I always want more. But it's very clear right now that we feel very comfortable that this year we will be able to produce 2.5 billion doses at least. So this is already a very big plus, particularly in the US. Already we fulfilled our promise that by end of March, we will release 120 million doses. We have done this, and we continue with our plans, and I'm sure we'll exceed our plans to give 200 by end of May and 300 by the end of July. The other thing that we can do, it is to make sure that the distribution, it is going to the places that the US government is recommending in smoothly and with high accuracy. And so far we have recorded 99.9% accuracy, which means that when we receive an order, 99.9% next day they will receive it, with few exceptions in Alaska and some other very remote places. And then the baton goes to the very competent hand of CVS and others, that they will make sure that those vaccines will be delivered to the people that need to be vaccinated.
Yeah, and like Albert, there's things under our control and there are things that aren't under our control. And obviously, first and foremost, is the supply. So we're happy that what we have, and we have the capacity to do a lot more. And, we have opened up 2,100 sites to do these vaccinations. We've hired a large number of technicians and pharmacists and nurses to get those shots in the arms. We have 10,000 stores, and we have the capacity to do 20 to 25 million shots a month. And the other thing I would say is that the one thing that we learned and we continue to refine is our digital capabilities. Our digital app is doing, is scheduling the first dose and the second dose. We have had, incredible response to our scheduling system through our app. And, as Albert said, we are, we're taking that baton and we're running with it and have a lot more capacity, and we won't let America down.
How many appointments can you schedule in a store per day? Obviously, it depends on the size of the store. I'll tell you, when I got my first shot, people were lined up. There was a big long line. It went fairly quickly, but there were a couple of times when something just didn't transfer over, so there was a bit of a wait. We also got the first appointments of the day, so I don't know what happened as the day went on. Are you finding that those appointments are met and people are coming back for their second shot on time?
Yeah, the number of shots that we can do a day depends on the supply that we have in the store. What we are finding is that 94% of people that have scheduled their second dose are coming back on the day that they scheduled their second dose. That speaks volumes to our scheduling. It speaks volumes to the experience that people are having. So people are coming back for that second dose. And I know, Albert, that makes you really happy.
And you've got a vaccine that's 95% effective. You're getting, virtually 95% of people coming back to get that second dose. This has been such an unprecedented rollout, especially since usually, when we've seen something like this in the past, for example, with polio, it was one shot and you're done. In this case, we're not sure that we're done with this after we get the 2 doses of this, or the 1 dose in the case of Johnson & Johnson. Albert, you've gotten some new data that suggests this does protect against variants, but is this going to be something that you're going to have to keep surveilling as new variants arise?
There are vaccines that, as like polio, that 1 dose is enough. There are vaccines like pneumococcal vaccine, the Prevnar, that 1 dose is enough for adults. And there are vaccines like flu that you need every year. The COVID virus looks more like the influenza virus than the polio virus. The duration of immunity was unknown until yesterday. There were data only about the first 90 days. Now, the first vaccine that comes out with data all the way to 6 months, that you can see all the way to 6 months, still very high protection, I think is us. And this is very, very good news. Protection goes down by time, but still in the 6 months is extremely high. Another very, very important information that came out recently was that we were effective against the South African variant. In South Africa, we had 800 people in the clinical trial, 400 received the vaccine, 400 received the placebo, and there were 9 cases of COVID, and all 9 cases were with the placebo group. None of the 400 vaccinated received, got infected. Very, very good news. If you're asking me, I think that there will be a need, based on this data, for revaccinations. We need to see what will be the sequence and for how often we need to do that. That remains to be seen. A likely scenario is that there will be likely a need for a 3rd dose somewhere between 6 and 12 months. And then from there will be an annual revaccination. But all of that needs to be confirmed. And again, the variants will play a key role. It is extremely important to suppress the pool of people that can be susceptible to the virus because they are vaccinated with high efficacy vaccines. Because the pool of people is what defines how many replications the virus will do, and that defines if or not and how many variants will appear. So the fact that there are people that are protected, this is what creates the new variants.
In some ways, this is a marathon that is a sprint at every single stage of it, right? Because we're still racing against time, even as we have all this great news. We've got the vaccine, we've got a lot of people vaccinated, but there is an awful lot of concern that even though we're close to the finish line, we could see a new surge that we can't really meet because people might resist being vaccinated, or it doesn't get to every place in the world. There are a lot of countries, developing countries, that haven't yet gotten the kind of access that we're seeing here in the US.
You're absolutely right on both. It is extremely important to make sure that we convince everyone who has hesitations right now, who has concerns, that they should receive the vaccine. By receiving the vaccine is not going to affect their own health. More importantly, they're going to affect the health of others, and very likely the health of the people that they love the most. That's extremely important to do it. The second is that in pandemics, you are as protected as your neighbor. You can't achieve protection if all the US people are vaccinated, but none of the Latin America, or very few in Latin America, or very few in Africa. They need to be vaccinated as well. This is why I think it is so important to be able to improve our manufacturing capacity. And this is why the first thing that we did was to do that, so that we will have vaccines for all. In general, I'm optimistic. It's not that this is not a nasty virus. It's not that there are unknowns, sometimes things about the virus. What makes me optimistic is what we know about the tools that we have right now. And we know that we've never had, very rarely, you have in medicine tools like the vaccines that we have right now with 95% efficacy, very rarely. And this is what makes me optimistic that we will be able to put this thing under control, and that is not in a very long distance.
Karen, one of the main tools that we've used has been digital signups. But because of, certainly in the older generation that was the first cohort to get the vaccine, they may not have had the skills. And plus these websites were new. It also resulted in a certain amount of inequity. It seemed as though those who were better equipped, had better broadband, or smarter about technology could get their shots and their appointments. What are some of the things you've done to try to counter that as we've continued the rollout and as we look ahead to really opening it up across the country?
Yeah, Bertha, we recognized that early on, and we did a couple things. We first you created a call center so that people could get their scheduled appointments through the call center. We also took our teams and did outreach calls, and we were reaching into the most vulnerable population of the people that we knew that we were either that had relationships with our pharmacy or that were part of our Aetna or Caremark health plans, and we would reach out to them. And one day we reached out. One of our call center agents reached out to a blind gentleman, and he said, "I was not going to get the vaccine. I tried and I couldn't figure out how to do it, and I'm so grateful that you called and that you are scheduling this for me, and I can't thank you enough." We also have a partnership with Lyft to get them to our retail locations so that they can get their vaccine. And we're also working with community partners like churches and the YMCA, and so that we can help educate. And we also have established a mobile unit, and we're out in the communities, in the heart of communities with our mobile units as well. So we're coming at the inequity in a variety of different ways, and we're making good progress. We have vaccinated 34% of the underrepresented minorities, and that compares to 18% of the total, kind of what the nation has done. So we are making very good progress, and our numbers are showing it.
I imagine, there are people who really could benefit from worksite vaccinations because they can't take time out of their job to go stand in line to get vaccinated at a mass vaccine site. They might not be able to make it to your store in time for their shift to get there. Are you also working with employers to try to get that happening, and with schools as well, as we look to back to schools? Obviously colleges and high schools, now that we know that the vaccine looks to be efficacious for younger teens.
Yeah, to answer your first question, I think it's both. I think it's access, and there is hesitancy, and I think there's a lot of work we can collectively do on education. We are working very closely. We tested this with a testing program. We did a return ready program with our with testing, where we went on site, and we are on site at a lot of companies today. So as supply becomes more available, we will be working with companies if they want to do vaccines at their work site. So that will be underway as soon as we have that supply to do it. We also have worked very closely with teachers. We opened up our retail locations for teachers, and we're in the process of looking at how we might partner with the government on getting into the school systems and helping with schools. And congratulations, Albert. I know that you're making good progress on children. So that will be really helpful when the schools open in September.
Albert, one of the key questions for schools reopening is whether we might see results for kids to get younger children vaccinated. What's your sense of the timeline for school-age children to be vaccinated? At what point will we know from the trial results?
We started already with kids 5 to 11 years old. Now that we have covered with studies 12 all the way to 100 and more. And the 5 to 11, I believe the results will come somewhere in the fourth quarter. If we'll be able to expedite it a little bit earlier. And then it's up to FDA to be able to review the data and approve it or not.
So we might start the school year with younger children still not vaccinated, but...
I think that's a possibility. Clearly, I think we should be able to cover, let's say, middle and high school, and then the elementary is what I think we are looking for now.
There have been people who have said we are probably going to get to a point early this summer when vaccine supply might actually exceed demand. And it was interesting, I recently heard the Commissioner of Health from West Virginia, which we know was one of the most successful states in getting per capita vaccination levels early on. She said her concern now is as things get wider, as we reach into younger people being eligible, that we might see them, not because of hesitation, but just because they feel that maybe they don't need to be vaccinated, that they might be the toughest sell to get them in there. I know you guys are working together to try to do public awareness. How do we convince this cohort that is tired of thinking about COVID, tired of thinking about the pandemic? You know, they want to go party and they don't want to have to think about these issues.
Well, I mean, myself, the most convincing argument that I have found in having discussions with young people, it is tell me how much you love your grandparents, your parents. This is the most convincing argument because immediately they understand that this is not about them, it is about the people that they love. And right now, this is the very critical point to understand that young people may feel that there are not so many cases of severe disease or deaths in their age, so they don't need it. But they are the people that will transmit to the others. They are the people that if they don't do the vaccine, will not allow society to reach herd immunity. This is why it is so extremely important that we all work together and that we all feel responsible for doing that, because that affects the society. When I say all, I think the last ones are Pfizer or CVS, that they may perceive that they have an interest in doing that. This is about journalists, scientists, politicians, religious leaders, community leaders. Everyone has a responsibility to preach the importance of the individual has to protect society when it comes to vaccinations. This needs to be a universal by all campaign of goodwill.
I think Albert captured it really well. I think, Bertha, it's, not only do we need to capture the minds and help educate, but we need to capture the heart. And I think when we go at the heart of why we want to do this, it's not just for you, it's for your loved ones, and it's protecting your loved ones in against this pandemic. And I think that we have to go at both. It's that heart and it's in the mind.
This has been such an incredible process, bringing the vaccine to the public. What do you think are some of the lasting lessons here for healthcare and for the country?
Yeah, if there's one thing the pandemic taught us, it was the vulnerability of our healthcare system. And it really did show us where we had weakness. And as we move forward, it's really important for all of us to think about social determinants of health and think about wrapping ourselves in the communities. And it starts with the basic needs like housing and nutrition. We're helping them with jobs. And then if those basic needs are met, then people will turn and think about their healthcare, but not until those basic needs are met. And we have a responsibility as part of our corporate social responsibility to make sure that we're, supporting the communities where we live and where we work. And, CVS has also invested over $600 million, to address and eradicate the racial inequities in this country. And we're quite proud of our investments there. Lots of work to be done. I think the healthcare system will change dramatically as a result. You'll continue to see a proliferation of virtual care. You'll continue to see digital access and in more ways for care. You'll continue to see healthcare done at home. And I think, testing, different kinds of testing is here to stay. And I do think the healthcare system has changed dramatically. And I'm hoping for the good. I'm really optimistic that this has, reshaped all of us in healthcare to think about how we can do things differently to improve the health of all Americans.
And Albert, I wondered, mRNA is an overnight success, decades in the making. I know you're an optimist, but as I see what's happened with COVID, I can't help but thinking about how many other diseases might be treatable this way. Has the success of the COVID vaccine made you think that we could jumpstart other types of treatment as quickly?
Yeah, I'm very optimistic about the mRNA technology. I'm very bullish on it. It was not overnight. It's the first thing that you said. It is years in the making. It was just the opportunity presented itself to demonstrate it in the most glorious way and pass with flying colors. But as you said, there are a few things that, first of all, are related with the mRNA technology, the power of this technology. I think to me it's very, very clear that can be used for other infectious diseases, prevention of other infectious diseases. But also there is a lot of scientific work happening right now in therapeutic applications in diseases like cancer and other neurological diseases. So I think it is the beginning of a new, very powerful technological platform that can bring significant breakthroughs to human health. But also there is another element related with the COVID and the research, which is that how we were able to move so fast with developing solutions. And this clearly didn't happen by doing things the same way. It happened by doing things differently. And I think that also is a very valuable book of lessons that we need to dig into it and see how many of them are applicable to cancer, to Alzheimer's, to Parkinson, to other devastating infectious diseases, so that we can bring treatments to people in a much, much faster way than society was used to.
That would be a wonderful lasting legacy, but of what has been an incredible and daunting challenge here in this country and certainly globally. And hopefully a year from now, we can say this has been vanquished with both of your help. Karen and Albert, thank you so much for what has been really an illuminating conversation. I've learned so much today. And thank you for joining us, and hope you got a lot out of it as well. If you'd like to learn more about what is going on with COVID-19, be sure to check out the CVS Health COVID Resource Center. The address is on your screen. Thanks again.